Hi everyone, my name is Jenna Kaiser, and today I will be talking to you a little bit about polymyositis. And at the end of this video presentation, I will be doing an interactive activity with my roommates about polymyositis tic-tac-toe, and it's a way for people to get engaged and pull out the key facts of this presentation and to learn about polymyositis. Thanks for watching.
Before I get started, I wanted to give a brief rundown of what the word polymyositis means. PM means many muscles being inflamed, where poly means many, myo means muscle, and situs means inflammation. On the screen, you can see the comparison of a healthy muscle fiber and a fiber that has been affected by polymyositis. In the healthy muscle fiber, you can see that the fiber is very clean, and like the picture states, the muscle fibers look like puzzle pieces that fit together neatly. Whereas in the muscle fiber that has polymyositis, it has been invaded by inflammatory cells. These immune system cells come in and invade the healthy tissue, causing them to become rounded and change shape. Ultimately, this is what causes people to experience pain and discomfort from a PM diagnosis. Polymyositis, or PM, is a rare skeletal muscle disease that causes chronic muscle inflammation that is also accompanied by muscle weakness. This is where the body's immune system sends out an autoimmune response to attack its own muscles and cause tissue damage. PM is classified as one of 4 subtypes of idiopathic inflammatory myositis. This occurs in the skeletal muscles most proximal to the core of the body. This includes the muscles in the hips, thighs, upper arms, shoulders, and the neck. This also occurs bilaterally on the body. The onset of PM can occur over days, weeks, or months. Here is an anterior and posterior visual of what the affected proximal skeletal muscles look like on the body. This shows where the bilateral weakness and inflammation occurs. A diagnosis is often difficult because there is still a lot unknown about PM's etiology. Therefore, it is very important to eliminate the differential diagnoses that are very similar to PM. However, we do know you must be referred to a rheumatologist. Muscle strength and weakness is the first step in diagnosis determination. One example for this test is to test proximal leg weakness. For this, you would have the client stand from a seated position without any support or help. Early in the disease, the client may be able to do this easily, while others may struggle more. This is where manual muscle screening tests are important. 8 muscles are tested on the client's dominant side, and this is recommended by the International Myositis Assessment and Clinical Studies Group, or IMAX. Another test is measuring skeletal muscle enzymes. This indicates prolonged and ongoing muscle damage. 75% of elevated enzymes indicate a PM diagnosis. One of these enzymes that are tested is creatine kinase because it is the most sensitive and indicates that there is muscle damage. It is important to note that muscle dysfunction can still be present without elevated enzymatic activity. Electromyography is also sometimes helpful in finding a diagnosis. However, sometimes its findings line up very similar to other muscular diseases. Imaging techniques are significant in the initial stages of diagnosis because it shows the presence of inflammation and muscle edema. MRI has shown positive results in soft tissue examination and does well at showing symmetrical bilateral inflammation in the core's proximal muscle groups. Ultrasound imaging is used to detect abnormal vascularization. However, it is not very reliable because it does not reach deep muscle groups that may be affected. Muscle biopsy has been the best way to receive a correct diagnosis of PM. For the most part, there is an unknown cause of PM. However, research suggests it may be triggered by environmental and genetic factors. Based off the research done, environmental factors include drugs, infection, ultraviolet light, vitamin D deficiencies, and smoking. For genetic predisposition, it has shown some promising evidence. However, the aspect of research was hard to be proven because different populations showed different results on whether genetics played a role or not. Signs and symptoms include muscle pain and stiffness, overall muscle weakness, joint pain and stiffness, dyspnea or difficulty breathing, dysphagia or difficulty swallowing, and arrhythmia, which is irregular heart rate. For prevalence and incidence, approximately 2 to 10 cases per 1 million people are diagnosed per year. There are less than 200,000 people in the world that have PM. Women are 2 times more likely to be diagnosed than males are. African Americans are 5 times more susceptible than Caucasians are to get PM. And there is a higher incidence found in those between the mid-40s and 50s of age. For related populations and lifespan considerations, the onset of PM occurs between 45 and 64 years of age, and it is very rare for there to be a diagnosis before that age frame. 20% of people who are diagnosed go into remission and recover with minor signs and symptoms. However, that leaves the other 80% of people who are diagnosed to have persisting muscle weakness and low muscular endurance for the remainder of their life. And I say life because since there is no cure, they just have to manage the signs and symptoms that they experience. Treatment is primarily based upon the signs and symptoms that are found among the client since there is no cure to PM. Medical management includes corticosteroids, which are usually used in a high dosage to control inflammation, immunosuppressants, which helps prevent the body's immune system from attacking itself, intravenous immunoglobulin, which is shown to improve muscle strength in the client. Physical therapy is used to work on range of motion and strength within the client, and then adaptive equipment is also utilized to make completing tasks easier. Risk factors or related disorders. The risk factors that are associated with polymyositis include pneumonia, infection, respiratory failure, weight loss, and malnutrition. And then the disorders that may occur with PM include arthritis, interstitial lung disease, Raynaud's phenomenon, increased risk for heart disease, aspiration pneumonia, antisynthetase syndrome, mixed connective tissue disease, overlap syndrome, and inflammatory cardiomyopathy. And all these disorders can occur at the same time that polymyositis is also happening in the individual. Some condition-related precautions that go along with PM is the risk of falling due to muscle weakness. There's a limited participation in daily life activities among those who are diagnosed. And along with that, PM is a systemic disease, meaning it can affect other organs in the body at once, and this could also cause other problems to arise besides the signs and symptoms related solely to PM. Here are the areas of occupational performance that are impacted by PM. Occupations include ADLs, IADLs, work, play, and leisure. Client factors include body functions and body structures. Performance skills includes motor skills. Performance patterns includes habits, routines, rituals, and roles. And context and environment includes personal, temporal, and physical factors. Occupational therapy intervention includes muscle strength evaluation involving active range of motion and passive range of motion if the client is not able to move on their own. Social, medical, and functional history of the client is also taken into account. After the client's evaluation and the OT collaborating with other healthcare professionals, the goals of the client become defined. These goals are different among each client and depends on the severity of their PM diagnosis. After that, an occupational therapy program is created to address the needs of the client in order to reach their designated goals. Here is my list of references that made this presentation possible. Here are the rules to polymyositis tic-tac-toe. First rule is first person to answer the question gets to play first. Second, if that person gets the question wrong, then the other person gets to play. And lastly, keep playing until someone gets 3 in a row.
Polymyositis tic-tac-toe, and our contestants are Sydney and Morgan. And to start off, our first question is, true or false, is there an unknown cause to PM?
Go. False.
True.
Oh, dang it. Oh, do I get to go?
Yep, you go. Next question, what does myo mean in polymyositis?
Muscle.
True. What gender is more likely to get PM?
Male.
True. What is one treatment method for PM?
Corticosteroids.
True.
Yay.
What is one risk factor to PM?
Respiratory failure.
Yes. Between what ages does PM occur?
40 and 64.
45 and 64.
Does that count as right?
You can do it, yes. What is one group of muscles that are affected by PM?
Skeletal.
True.
I win.
Oh.
And then Sydney wins.